everyone, and welcome back to AHTV, Aortic Hope's YouTube channel. If you're new here, welcome. And to the Aortic Hope community, thank you for being here and thank you for always showing up. I'm Molly Thomas, and this is your Week in Review. This is where we take a moment to reflect and reconnect and highlight what we shared last week across the community. And this channel exists for one reason, and that is to create connection, to educate, and to offer hope for patients, caregivers, survivors, and anyone touched with aortic disease. If you will, don't forget to like and subscribe to this YouTube channel, and also share it to your friends and family. You never know who it might touch and affect. And also hit that little notification bell because that way you will get notified anytime AHTV and Aortic Hope go live. All right, let's get moving, and we're just going to move right along to our Medical Monday. However, before we do that, I'd like to thank our sponsors, Cook Medical and Edwards Life Sciences, for making this week's Week in Review happen. So Cook Medical is a local. They're from Bloomington, Indiana, and they innovate and manufacture quality medical devices to help improve lives with those touched by aortic disease. And Edwards Life Sciences is the global leader of very patient-focused innovations for structural heart disease and critical care monitoring and devices. Click on those logos, and it'll take you to everything about Cook Medical and Edwards Life Sciences, and we thank them so much for making this happen. All right, moving right along to a Medical Monday. This is contributed by Adam Ahmed, Dr. Adam Ahmed, who was one of our med students, and he is now a full-fledged doctor. And we're so grateful to have him and his team of medical students that contribute every week to our Medical Monday and Topic Tuesday for all things medical and heart disease, valve disease, aortic disease related. All right, so he's going to kick off here. I'll just go ahead and read it. I can't pretend to know all this mumbo jumbo of medical terms, but I'm just going to read it. And he starts off by saying, "Good morning, everyone, and welcome to our first week of February posts. This theme this month will be aortic valve disease. As you know, February is Aortic Valve Disease Awareness Month. To understand aortic valve disease, we must first understand what the normal aortic valve is and what it does. After blood gets oxygenated into your lungs, it re-enters the heart and fills the left ventricle. With each heartbeat, the left ventricle will pump blood through the aortic valve into the aorta, which carries it through onto the rest of the body. The aortic valve, therefore, can be thought of as the gatekeeper between the heart and the rest of the body. It's the last valve blood will cross in the heart. To remember normal aortic valve anatomy, think of the infamous Mercedes-Benz logo. Most aortic valves are tri-leaflet in structure, meaning 3 leaflets come together when it closes to prevent blood from leaking backwards. And they also open at the same time to allow blood to flow out. So when looking at the aortic valve leaflets, it's important to think of each of the 3 separately. Normally, we could divide the 3 leaflets into a left coronary cusp, a right coronary cusp, and a non-coronary cusp. And here's a great diagram of this. The right coronary artery, also known as RCA, and the left coronary artery, LCA, originate from each respective cusp and function to provide blood to the surface to the heart. When repairing or replacing a damaged aortic valve, surgeons must be very careful that they do not block the blood flow into the RCA and the LCA. So when performing surgery, surgeons must also be mindful of nearby structures to each cusp. For example, the left and non-coronary cusps are very close to the mitral valve and can be damaged when operating there. Alternatively, the right and non-coronary cusp are near the tricuspid valve, and the conduction system of the heart and damage there may cause heart block that requires a pacemaker. This month, we will be focusing on many specific diseases related to our beloved aortic valve, including what happens when it becomes too tight, also known as aortic stenosis, it becomes too leaky, aortic regurgitation, or when it has only 2 leaflets instead of 3, it's called a bicuspid valve, as well as some of the nuances of treating aortic valve disease, including different kinds of surgeries and types of valves. This should be an interesting month of educating us all about aortic valve disease. All right, he doesn't want to spoil us too much, so be sure to tune in every single Monday and Tuesday of this month for more aortic valve education. Until then, stay warm and think aorta, says Adam. All right, thank you so much for that, Adam. And moving right along, we included also a movement for Movement Monday. And it's just always a good reminder to motivate you to get up, get moving, and anything counts. Any amount of time and movement counts. That is, if your healthcare provider has cleared you for any type of movement. So, did you know that just 1 hour of movement can add up to an extra 1.95? Let's just round it up to 2 extra days of life. It's not about running marathons or crushing intense workouts. It's about showing up for your body, one step, one stretch, one dance move at a time. So at Aortic Hope, we believe that movement looks different on everyone. You could be an ultra marathon runner, and we have some of them. We have, weightlifters. We have people who, we have the whole spectrum, and everyone is represented and celebrated for anything they do. Whether it's Qigong, a simple walk around the block, even gentle stretching, it all counts. It all counts. Just remember, this journey is a marathon. It's not a sprint. There's no rush for this, but every single movement counts. And we're here to support you every step of the way to help educate, encourage, and remind you that progress doesn't have to be perfect to be powerful. All right, moving on to Topic Tuesday, we have Alvaro has come and contributed a great article on aortic stenosis. All right. Alvaro is one of our med students, and he is part of the team that Adam leads. And we're so grateful to have Alvaro here to help us understand and educate us on all things aortic valve. All right. So aortic stenosis is one of the most common and serious valve diseases. It occurs when the aortic valve opening becomes narrowed, making it harder for blood to leave the heart and reach the body. At first, the heart compensates, but over time, that compensation fails. It just gets tired. And then symptoms start to appear. Here's a little diagram of a healthy aortic valve, open and closed, and then aortic valve stenosis, which shows a very sad and tired valve. Oof. All right, so how does this happen? Think of the aortic valve like a door that should open wide with every heartbeat. In aortic stenosis, that door becomes stiff and narrow. And this happens because there's a progressive calcification of the valve leaflets, chronic inflammation, and as the opening starts to narrow, blood flow out of the heart is restricted, and the left ventricle must generate higher pressure to push that blood through. The heart muscle begins to thicken, which is called left ventricular hypertrophy. At first, this helps maintain blood flow, but over time, the thickened muscle becomes stiff, oxygen demand increases, and the heart begins to fail. A simple way to understand it is imagine trying to blow into a straw. A very wide straw, it's very easy. A very narrow straw, it gets harder and you get exhausted. And that's exactly what happens to the heart in aortic stenosis. There is a disease progression scale, and it's stage A through D. And here we go. Stage A is people who don't yet have stenosis, but they are at risk. And they're at risk because they have either a bicuspid aortic valve, aortic sclerosis, or a history of rheumatic disease. There are no symptoms, and management is mainly controlling hypertension, lipids, diabetes, periodic getting echocardiographic follow-ups. There's no surgery or intervention at this time. So going on to stage B, it's starting to progress, and structural valve disease is present with mild to moderate obstruction. Some findings are increased valve calcification, mild to moderate gradient elevation. Symptoms are, it's still usually asymptomatic. Your left valve function is preserved, and optimized blood pressure is what they're going for. Treat coronary disease if it's present and avoid unnecessary vasodilation. There's no valve intervention yet. Regular echocardiograms surveillance is expected. Surgery is not indicated unless there is another cardiac surgery plan, and then they'll discuss that. So we're getting into the third stage, stage 3, and that's severe. Severe, but still asymptomatic. So the valve at this point is severely narrowed, but the patient still has no symptoms. This stage is divided into two. One is you have normal left ventricular function, and but you have severe stenosis and a preserved ejection fraction. The second stage is left ventricular dysfunction, severe stenosis also, and a reduced ejection fraction under 50%, even without symptoms. So management for the first stage is careful monitoring, exercise testing in selected patients. And the second stage, there's an aortic valve replacement, is strongly recommended even if you're asymptomatic. Left ventricular dysfunction equals the heart is already failing to compensate. So this is the most advanced stage and most dangerous stage. There's severe valve obstruction. There's symptoms of angina, dyspnea, heart failure, syncope, fainting. There's subtypes. Oh gosh, we get into lots here. Subtypes, we have D1 is high gradient, severe aortic stenosis. D2 is low flow, low gradient with reduced ejection fraction. And D3 is paradoxical, low flow, low gradient with preserved ejection fraction. And I think I would leave that to the medical professional to decide what subtype I was. Okay, so definitive intervention is mandatory. A surgical a SAVR or a transcatheter, a TAVR is recommended. And this choice depends on your surgical risk, your age, anatomy, any comorbidities. And just saying that intervention of surgery is expected because medical therapy alone is not sufficient at this stage. The key takeaway, Adam says, is aortic stenosis is not just a valve problem. It's a disease of progressive pressure overload of the heart. Understanding the pathophysiology helps explain why the symptoms appear late, why the timing of intervention is crucial, and why treatment must be individualized. So in the next few weeks, we're going to dive deeper into how we decide between surgery and endovascular treatment, how imaging guides management, and what outcomes look like for each approach. If you have any questions, just drop us a line and we will be happy to help answer that question or direct you to someone who can. All right. Also this month, we have Marfan Awareness Month. And if you're not familiar with Marfan syndrome, go ahead and check out their website, marfan.org. Aortic Hope works closely with the Marfan Foundation, and it's a disease very closely related to aortic disease, aortic valve, aortic dissection, aneurysm, and this is Marfan Month, Awareness Month. So if you're not aware, go check it out. If you already are, go dig a little bit deeper and learn a little bit more about this disease. All right, moving on to Friday. This was the first Friday of the month, which is our Friday fundraiser. And as you know, at Aortic Hope, it is patient-led and donation-supported only. this community is receives the support due to all the generous donations from the community and sponsors, and we're so grateful for that. We rely on it, and one way to do so is to check out our Hope Shops, in particular the help belts. These help belts go on your backpack, your dog leash, a baby stroller, your car seatbelt, every car you own. Keep one in your purse in case you ride Ubers. This kind of thing, because it has a form inside that gives all kinds of medical information about you. So if you're incapacitated or unable to speak about your medical history, this will speak for you. And they're really important. It's February. It's a special month. They're running a special, and it's $14 donation. And in return, you get a red or a black help belt. If you do reside overseas or internationally, it's a $23 donation, and all shipping is free. So there's a little link here to click on the form and go grab yours today while we're running the special. And while you're at it, go check out the hoodies and the t-shirts and the hats and all kinds of stuff, decals, and there's a lot of things that we have here that at Aortic Hope that we like to start conversations. When you're wearing one of these hoodies or t-shirts or caps, people stop you and say, what is that? Aortic is unfortunately, not a real common term in around town. So if you're wearing something that gets somebody's attention, it's a great conversation starter. All right. My favorite, Survivor Series Saturday. And this one in particular, it's Replay Saturday, Survivor Series Replay Saturday, where we replay some of our most viewed Survivor Series. And right now I think we're pushing 200 stories that we have recorded throughout the years, and they're just great. I love this series. It helps to bring awareness and hope to people who watch these stories and listen to the firsthand, what's people. Anyway, in this case, it's Ken Martin, and Ken hails from Brisbane, Australia. He's such a lovely man. He shows up on occasion in our support groups and in some of our forums, and he's just such a lovely man. And I really enjoyed his story. He tells a great story, and we look forward to maybe one of his follow-up stories. We're trying to get him to work on where he is now. It's been a few years, but he tells such a great story. Ken Martin, go check it out. It's here on our AHTV YouTube channel under podcasts, and from there you can just scroll around and check out all of them. I really enjoy them. I think you will too. All right, wrapping up this week in review, we have the upcoming events, and here we have a list of all of our support groups that are offered. We have a caregivers only group. It's closed, but you just click on that red caregivers link and sign up, and they'll let you in, and they meet twice a month. We have multiple support groups throughout the month. We have a Canadian support group, Grupo de Apoyo, which is a Spanish-speaking group. That date will be determined soon. And we also have every other month meeting the bereavement group. This week in particular, we have tomorrow we have a support group meeting. It's called the West Coast meeting because it meets later on the East Coast, 10 p.m., 7 p.m. on the West Coast. And then Wednesday, we have the Caregiver Connection for caregivers only, and that meets at 10 p.m. Eastern as well. And then Thursday, the 11th, we have the bereavement group meeting. And then coming up next week, we have, I think Karen's going to deliver our weekend review. So it's always fun to see her. And in the meantime, thank you so much for joining. And don't forget to like and subscribe and hit that notification bell and share away, because the more you share shows the more you care. Oh, just made that one up. All right. Take care, guys. Have a nice week. Bye-bye.